Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. In this today's very important video, I am discussing those very important high yield topic where the 3 to 5 questions are repeatedly striking in the exams. I think all of you got the clue about the class from the thumbnail I have given here, that is on the national health programs. So here in this today's video, we are discussing the very important and trending and the programs which are repeatedly striking in the exams with in detail explanation, easy explanation, and the complete purpose of this class is to strike maximum in the your upcoming NORCET exams and all other state and central government exams. Students, studying everything is not important. Studying the thing which is coming in the exam is most important. So you people have very short time for the NORCET-09 exams. So focus on the content which is striking in the exams, plus cover all the major subject. Right. So in this today's very important particular video, I am going to secure your 3 to 5 marks in your upcoming exams with a crystal clear explanation of the everything which is most important, and I will highlight the those very key important point about a particular national health program. Just you have to remember those very important point what I'm teaching here, and that is only will strike in your upcoming exams. Okay, so we will start the today's class with this very important beautiful motivational quote here. Stay focused on your goals and ignore the noise. Students, this is the time to ignore the negativity, to ignore the noise, to ignore the pullback things. And this is the time to bounce back, and this is the time to convert your sign to your autograph. So, if you want to convert your sign to your autograph, means you have to maintain dedication, you have to set your goal, you have to maintain the discipline, you have to sacrifice something, then only your sign will get converted into the autograph, right? So students, just come out of the negative things and stay focused and focus on your goals. If you are busy in your work, means there is no time to listen the unnecessary noisy things, right? So hope the thing is clear here. And this is the part one of the National Health Program, which is available in the YouTube and app both with free of cost. The next class on the National Health Program, it will be in the two parts, part one and part two. Okay, in the second part, I am going to take only in the app. Okay, so who all are still not downloaded the Master Nursing Classes app, I have given the link in the description box. You can everyone can download that one after the end of this particular very important class. Okay, so we will start a first very important question that is repeatedly striking in the exams. What is the recommended dose of the albendazole? This is the question from the National Deworming Day. Okay, so for children's aged of the 1 to 2 years, focus these two very important points here. Okay, so dose of the albendazole and age group is most important here, because based on the age groups we are dividing the albendazole dose here. Okay, so option A is the 100 mg tablet once, no. Option B 300 mg tablets once, no. Option C 400 mg tablet once. This is for the more than 2 years children. Okay, so half of the 400 mg tablet once we can say, or we can say just as a 200 mg tablets. Okay, once. This is the most important. This is for the less than 2 years children. Okay, so in our question the age group was mentioned 1 to 2 year, means this that is the less than 2 year child. So here we have to give a 200 mg once, or we can say the half of the 400. Again it is comes to the 200 mg. So this goes to the correct answer. Bacho, while giving the answer for this dose of the albendazole, just focus on the age. Okay, age is the most important here. Don't forget. Okay, so albendazole is the tablet where we will give to destroy the worms. Okay, so let me discuss the highlighted and golden points on the National Deworming Day, okay, which is launched in the year of the 2015 by the Ministry of Health and Family Welfare by the our government of India. Okay, so it is observed February 10th and August 10 every year. So means two times in a year we are celebrating this one. So I call this one as in the bi. Bi means two in a 1 year. So I call this one as in the biannual program. Okay. So the National Deworming Day is a biannual program where we are doing this one in a two times in a 1 year. Okay, so that is on the February 10th and August 10th. So this is the biannual program, the most important point you have to consider. But this program we will celebrate only one time in two states. Okay, one is Rajasthan, another one is Madhya Pradesh. Okay, so in the Rajasthan and Madhya Pradesh, only one time we will celebrate because the incidence of the this particular worm infestation is less than 20% in these two states. So we will celebrate only means we will implement this program only one time in a year in these only two states. Okay, in the Rajasthan and Madhya Pradesh. So rest all the states of the India implements this particular National Deworming Day two times, means biannual. That is the very important thing. And these two important dates, February 10 and August 10 of the every year. So this one asked in our NORCET-08 prelims exam also, NORCET-08 mains exams also. Okay, most important thing you have to consider this one. Okay. Then comes to the objectives is to deworm the all the children of the age group of the 1 to 19 year. Okay, so it's most important. 1 to 19 year means here we will again divide 1 to 2 years means less than 2 year half of the 400 mg tablets, and 2 to 19 year here the one tablet 400 mg. So this is the most important drug dose. Okay, so which will repeatedly asking in the exam. So target group is the 1 to 19 year is the most important. All you people have to understand and give. So where we will get this 1 to 19 year children? We will get these children in the Anganwadi center, and we will get this one in the school. Okay, and so in the health educational institutes only we will get the these age groups childrens, right? So for that one, to implement this National Deworming Day program, so we have to directly go to the Anganwadi centers and we have to give the tablets, and we have to go for the schools. Okay, we have to go for the school to implement this particular very important programs. Okay, if I am going to a school on February 10, okay, on that day few children are absent. So I will not avoid those children. To follow that those children, I will go on next day or after 2 days again to the school, and I will give the albendazole tablet to the all the children who are absent on the that particular day of the program, and that is what you call the mop up day. Okay, what you call that one? Mop up day. So on the mop up day, we will give the albendazole tablet to the children who are absent to the class on the day of the program we implemented. Okay, so this is the most important, and you have to remember one more very important thing. This is to destroy the all soil transmitted elements. Okay, so what are the soil transmitted elements are there? To destroy those elements we are celebrating this particular very important programs. Okay, bacho, this is the slide of the golden word which will give you a lakh rupees salary per month. Focus. Okay, focus. One more time. Write two more time and practice three more time. Right, it's the most important for you all. Okay, and who all are preferring for the NORCET-09 exams, if you are searching for a best and all new questions, trending questions, important questions, updated questions practice, means here is the NORCET-09 Navagraha test series, a course for the good rank. So already we have launched this course in the master nursing classes app. Okay, so where you will get a daily live exam from the morning 6 a.m. to the till night 11 p.m. The exam is live. Anywhere between this time you can attend the exam. Most importantly, then at the 11:30 p.m. you will get the all India rank in our official WhatsApp group and Telegram group, and extra practice papers are available for you people on the mains exam pattern also and in the prelims exam pattern also, and weekly booster class like this what I'm taking class today on the important programs and the golden words chantings on the important programs like this classes will be available to you people on the weekly booster class basis, and chat box support is there for your doubt clearance on the any kind of the questions concept which you are having in your mind. If you want to clear the doubt on that one, so there is chat box also available for you people to ask the doubt, and doubt clearance will be there, okay, within short period of the time. Then the validity of the course will be 7 months, but you will get the live exam till the NORCET-09 mains exams, okay. So the most important plan for you people who are already preferred and your theory is completed and you are looking for the good question practices means just go for this one. And if you are new also, you can just practice with this one because we have given the clear rationale to the every questions, right? So here is the next most important 1,000 point important question on the national anemia mukt bharat guidelines and programs. Most important, students, from this one particular anemia mukt bharat program we got 4 questions in the NORCET 8 mains exams and 2 questions in the NORCET 8 prelims exams. One program, 6 questions, the most important program for your again upcoming exams. At least 2 questions again the examiner strikes in the upcoming NORCET 9 exam. So I want to fix those very important 2 questions, okay, in your mind because it is very important, right? So the question is very simple. Yes, that's the as per the anemia mukt bharat guidelines, what is the recommended daily dose of the iron and folic acid for the pregnant woman, okay. Students, what are the things and updated things I am teaching here in this today's class is completely taken from the updated edition of the our best book of the community health nursing, or we can say the uh, like a diamond book for the community study, that is the K Park book, okay. So entire data from there only, so no need to go for any updates to you people because the recent edition only whatever the things are there, so have extracted from that there what is the important thing to you people, okay. So as per the anemia mukt bharat guidelines, so what is the recommended daily dose of the iron and folic acid for the pregnant woman? So in the second and third trimester for the prophylactic supplementation, okay. So there is a basic concept here if people have to understand. We will give a folic acid to a mother, okay. So consider this is the entire duration of the pregnancy. This is the first trimester, second trimester, this is the third trimester. Here before the first trimester, that is the 4 week before the first trimester, and entire duration of the first trimester, okay. So 4 week before first trimester, before first trimester, and entire duration of the first trimester. Here that is we can consider as a 3 months. We are giving a folic acid, okay, folic acid prophylactic dose to prevent neural tube defect, okay. So here iron we will not give, only folic acid we will give to prevent the neural tube defect. Most importantly, okay, if I am giving the prophylactic dose of the neural tube prophylactic dose of the folic acid, means I have to start this one before the 4 week of the conception or the planned pregnancy, and I will give entire first trimester of the pregnancy, okay. So after the first trimester, in the second and third trimester, I will start the iron plus folic acid, okay. So here this is not to prevent the neural tube defect, this is to prevent the dimorphic anemia. Sir, what is dimorphic anemia? Di means two, morphic means two morphology, anemia means deficiency of the thing which is making the blood perfectly, okay. Here two things are getting deficient in the pregnancy, one is iron and another one is the folic acid, okay. So if iron and folic acid both are got deficit and there is chance of the anemia, so I am calling this one as a dimorphic anemia, that is the iron and folic acid deficiency anemia. So here I have to give both iron and folic acid. Okay, so this second and third trimester of the pregnancy, and that is the 180 day of the pregnancy, and after the delivery again I will continue 180 days. Okay, so this is the under the Anemia Mukt Bharat program. Okay, so this is not under the Anemia Mukt Bharat program. So let me comes to the dose of the iron and folic acid. I hope you people got why I will give the iron and folic acid. Okay, from the second and third trimester to prevent the dimorphic anemia. In the first trimester and before the first trimester, I am giving the folic acid alone for the prevention of the neural tube defect. These are the very important and basic concepts you people have to understand about this one. Okay, so then comes to the Anemia Mukta Bharat program, iron and folic acid doses. Okay, in the second and third trimester. So the dose is clearly very importantly, that is all you people have to know. That is the 60 mg of the elemental iron I have to give plus 500 microgram of the folic acid I have to give. That is once daily. Most important, bacho, in your exams there is chance of the coming the question 60 mg 500 mg plus here the examiner will change the once daily, once weekly, once monthly, okay, twice daily, like this the examiner can change. So that's what I have included everything in a single option. That is the best statement. One day, one tablet of the iron and folic acid. So one time, it is most important, all you people have to understand. 60 mg of the elemental iron plus 500 mg of the folic acid once a daily is the most important for the a pregnant woman, for the pregnant woman. Okay, the most important thing, right? So I will show you a chart of the dose distribution under the Anemia Mukta Bharat program. That chart is a very important and golden chart for you all. Okay. So before that one, let's understand some very important fact on the Anemia Mukta Bharat program. Okay. So it is launched in the year of the 2018. There is less chance of the asking the questions, but still as a basic, we will have to study this one. Okay. So it is under the Ministry of the Health and Family Welfare by the Government of India. So main aim of the Anemia Mukta Bharat program is to reduce the dimorphic anemia. So what is the meaning of the dimorphic anemia? That is the iron plus folic acid both are get deficit. Okay, so this is what you call as the dimorphic anemia across the all age group. Okay, so let me see some logo of the Anemia Mukta Bharat program. This is the logo of the Anemia Mukta Bharat program. Okay, there may be a chance of asking the image based questions because in the last exam, I think NORCET-08 prelims exam, they have asked the logo of the our Laksh program. Okay, so that is the labor quality index program. So where I will teach you that program also. So there is chance of asking program because it is the very hot topic. I am showing you a logo also here. This is the Anemia Mukta Bharat program logo. Okay, and it is having a most important strategy of the 6 into 6 into 6. Okay, so that is the 1 6 is for the 6 beneficiaries here, and 6 another 6 one is for the 6 interventions we are having, and another 6 here the 6 institutional mechanisms we are having. Okay, so in the 6 beneficiaries, so we are having the 6 different age groups here. Okay, so 6 interventions where we are having the 6 type of the plan to come out of the this anemia in the pregnancy. Okay, most important, all you people have to understand about this one. I will explain what is the 6 into 6 into 6 strategy, and in your NORCET 8 mains exam, okay, they have asked the direct questions. So which program works on the basis of the 6 into 6 into 6 strategy? That is the our Anemia Mukta Bharat program works on the. Okay, so this particular very important program, so that is the Anemia Mukta Bharat program, right? So most important to you people, right? So this is the basic you people have to understand here. Okay, so that is only same thing I have given in the Hindi. That is the Anemia Mukta Bharat program, the logo. Okay, so let me see what is the 6 into 6 into 6 strategy in detail. Okay, so here the 6 into 6 into 6 strategy, the first 6 includes the 6 targeted beneficiaries are there. So here the 6 different age groups, there are the children from the 6 month to 59 month, and children of the age group of the 5 to 9 years, then adolescents 10 to 19 years. These adolescent children, both boy and girl included, both boy and girl included, and here both boy and girl included. Okay, both boys and girls included, right? So then comes to the woman, mother. Okay, then again, so here only these are the females are included here, right? So first, second, like woman of the reproductive age from the 15 to what we can say the 49 years. So we can say in the Anemia Mukt Bharat program, this comes to the 20 to 49 years. Why? Because here till the 19 years it is included in the adolescents only. Okay, make it correction. Actually, woman of the reproductive age is from the 15 to 49 year only. That is the correct only. But in the Anemia Mukta Bharat program, the woman of the reproductive age is included till from the 20 to 49 years. All the standard book, including the K-Park book, given the 20 to 49 year only. So this minor focus you have to make here. Okay, so then comes to the a pregnant woman, then the lactating means the breastfeeding woman. So these are the all six beneficiary age groups are there. So most importantly, then again next six, including the six intervention we are having. So in this one, we are giving the a prophylactic iron and folic acid supplementation. Okay, to the pregnant woman, to the school adolescent girls, to the children of the what we can say 5 months to the 59 months. Okay, so then child of the what we can say all the age groups. So already we have discussed 6 months to the 59 months and 5 years to the 9 years, and all the age groups. So for all the age groups we are giving the prophylactic iron and folic acid supplementation. Next very important thing, that is the deworming. We have discussed already in the deworming. We are giving the tablet albendazole. Okay, so 1 to 2 year age group means below 2 year age group 200 mg albendazole. More than 2 years till the 19 years, that is the 400 mg albendazole. Okay, so it is a biannual program. All the states of the India, we are implementing the deworming, national deworming day two times. Okay, one is February 10, another is the August 10. Okay, except the Rajasthan and Madhya Pradesh, because there is less chance of the incident, means there is a less incidence, less than the 20%. Okay, so that's what we are implementing one time in the Rajasthan and Madhya Pradesh. Okay, so the most important, then the intensified behavior challenges and changes in the communication. So that one we have to maintain here about the health, diet and health hygiene, not an important point. Then the testing and treatment of the anemia using the digital methods. Okay, so here we can use some digital methods to test the anemia. When the pregnant woman visits the PHC, we have to test her hemoglobin level at the PHC level only. So by using the digital methods of checking the hemoglobin. Okay, the most importantly, it is included in the sixth intervention part. Okay, testing and treatment of the anemia by using the digital methods. Then the mandatory fortification of the food. Okay, but so there are two very important points all people have to understand in the nutrition. One is the fortification of the food and another one is the adulteration of the food. Okay, so what is the fortification of the food? What is the fortification of food? And what is the adulteration of food? Adulteration of food. Okay, so here is a basic food is there. For this basic food, I am adding something. Okay, I am adding something. So that may be a preservative, that may be a nutritive, whatever it may be. I am adding something. That particular thing which I am adding, which increasing the nutritive value, which increasing the nutritive value means it increasing the protein level, it may increasing the calorie level, it may increasing the good fatty acids level. Okay, so if I am adding something which improving the nutritive value of the food, or it improving the quality of the food, that is what we call as the fortification. For example, so in the salt. Okay, in the salt I am adding the iodine, right? So in the salt I am adding the iodine, means so only having the salt is not helpful. If I am having the salt with iodine, I can prevent the goiter. Okay, so it increasing the quality of the food, or we can say a nutritive value of the food. That is what you call as the fortification. But one more very important term is the adulteration of the food. Okay, so the to the basic food I am adding something where it is decreasing the quality of the food, or we can say it is decreasing the nutritive value of the food. Okay, so that is what we call as in the adulteration of the food. Okay, so in here this one we have to improve the food quality or the nutritive value. Okay, that is mandatory to improve the fortification of the food. Okay, for the wheat and rice we have to add the extra proteins, extra calories. Okay, for the pregnant women and the lactating women, right? Then addressing the non-nutritional causes of the anemia. Okay, so only not anemia not only happens due to the iron and folic acid deficiency. It may happens due to the some malaria. In the malaria there is in the erythrocyte phase. Okay, so that destroys all the our erythrocytes, and or we can say the red blood cells, right? So that is not due to the nutritive deficiency. That is due to the infection, malaria happening, right? So that is due to the malaria, the anemia happening. Okay, so that is what all are the non-nutritional causes of the anemia is there. So that one we have to address and identify here. Okay, so some hemoglobinopathies are there. So means there is a chance of damage to the hemoglobin. So that one also we have to identify here. Okay, so six intervention. I hope you people understood. Okay. So most importantly, prophylactic and prophylactic iron and folic acid supplementation. This one repeatedly asked a question. Deworming repeatedly asked a question. Fortification of the food repeatedly asked a question. And addressing the non-nutritional anemia. So very less chance. And testing and treatment of the anemia digital methods. Very less chance. And another point also very less chance here. Okay. So all you people have to understand about these three very important points. Okay, among the six interventions, all six are important, but these three are most important for your exam purpose, right? Hope it is clear. So we have discussed six beneficiaries, six interventions, then six institutional mechanisms are there. Means to implement this anemia mukt bharat program, we have to integrate and we have to work along with the another institutes also to maintain the proper communication. Okay, to maintain the to get the proper resources for the implementation of the program. Okay, so there are six institutional mechanisms are there. So here interministerial coordination will be there. Okay, so then covering with the school and Anganwadi services, like we have to integrate this one with the ICDS and RBSK programs, so it will be easy to implement. Okay, so then comes to this capacity building, where we will improve our healthcare providers training and all. Okay, then digital monitoring tools and like supply chain management and community mobilization. So these all things we have to uh, focus over here. Okay, it's not important, just understand six institutional mechanisms are there, six intervention. Among the six intervention, the most important thing I have explained, and six age groups are there. So these are the most important for you people. And here is the golden chart point. Okay, so the 1,000 star, not only 100, this is the 1,000 star important chart for you people. Again the question will strike in your upcoming NORCET-09 exam, and NORCET-10 also the question will come, 11 also question will come, 12 also question will come, but the question will definitely come from this particular chart. Okay, so that is the frequency, form, dose of the iron and folic acid according to the age group. Okay, bacho, very simple. Children is there, give small dose of the iron and give the again small dose of the folic acid. The standard dose of the pregnant woman, you remember. Okay, already we have discussed the question, that is the 60 mg of the elemental iron, then 500 mg of the folic acid daily. That is the after the first trimester, means from the second and third trimester for 180 days. Okay, till after the pregnancy, till 180 days we will give for the lactating mother here. Okay, so same dose again, 60 mg of the iron, 500 mg of the folic acid. Okay, 180 days after the delivery. Okay, so this is the most important point, standard dose you have to remember. Okay, so here the child is there, means we will give the 20 mg of the iron and 100 mg of the folic acid. Okay, so bi-weekly means twice a week we will give here. Okay, so it will be in the syrup form. So we will give 1 ml 1 ml syrup. Okay, so that is will be the standard dose of the 20 mg 100 microgram. Okay, 20 mg of the iron and the 100 microgram of the folic acid it will go. Okay, so then comes to the children of the age group of the 5 to 9 years. Okay, so for these children we have to give a 45 mg of the elemental iron and 400 microgram of the folic acid once weekly. Okay, so then a tablet color here is the pink color tablet it will come. Okay, so then the adolescents, both boys and girls, here we will give a 60 mg of the elemental iron and 500 mg of the micro folic acid, same like pregnant woman dose we are giving here to the adolescent boys, adolescent girls. Okay, but in the pregnant woman and lactating woman daily we are giving the same thing. In the adolescent girls and in the woman of the reproductive age, same dose, 60 mg of the elemental iron, 500 microgram of the folic acid. Again here also 60 mg of the elemental iron, 500 microgram of the folic acid. Okay, but weekly we are giving here. Okay, so the most important for the children's bi-weekly, for the children's of the 5 to 9 year weekly, then adolescent woman, woman of the reproductive age weekly. Okay, but daily only given for the pregnant woman and lactating woman, the daily. Okay, for rest are weekly, then bi-weekly. Okay, so these are all 6 age groups, and this is the iron folic acid dose, frequency, and color code of the tablet is also there. Take a screenshot of this one or make a note in your last minute revision notebook, and definitely you should need to revise this one, but because any questions may strikes from this particular chart. Okay, so it may be a dose they will ask for the adolescent girls of the 10 to 19 year, or the adolescent boys of the 10 to 19 year. Okay, the dose may he will ask. Your answer would be 60 mg of the elemental iron, 500 mg of the folic acid, that is weekly once. A tablet is blue in color. Okay, this much perfect you are must and should be on this particular chart because it is very important, right? So the next one is here, the most trending question which was asked in your ESSC UPSC exams and in your CRE exam also, regarding the Rajiv Awas Yojana. This is the old Yojana only. Okay, but now it is in trend, don't know why. Okay, so in the recent exams it was striked many times. Okay, so that is what I'm teaching you this particular very important program here, that is the Raju Awash Yojana. Okay, so we can say the ray also here, this one now submerged with the PM AY, that is the Pradhan Mantri Awas Yojana. Okay, so in the 2015, so before that one, it was launched in the 2011 only. Okay, so by the Minister of the Housing and Urban Poverty Alleviation. So in that, under that ministry it was launched. So main target is here, this was on the name of the Rajiv Gandhi. Okay, so Awas means here we are giving a home to the home construction to the very poor and slum area peoples. Okay, so the most important, the target group of the Raja Awas Yojana is the slum dwellers and the urban poor peoples. Okay, so the main goal of the Raja Awas Yojana is the to make India slum free. Okay, so to make the India slum free through the rehabilitation and redevelopment and new housing. Okay, so that is the most important thing all you people have to understand. Yes, what is the Raja Awas Yojana? In the Raja Awas Yojana, it was on the name of the Rajiv Gandhi. Okay, so Awas means we are giving the home to the poor people who is living in the slum areas. The main goal of the Raju Awas Yojana is, yes, the most importantly, to make the India slum free. Okay, and so to give the new house or homing to the our poor peoples of the India. The most important question. Okay, again it means strikes in your exams. Okay, hope it is clear. Then comes to the next, the question on the our ICDS program. Okay, so most important, very basic and very important question. Okay, so who is the primary ground level functionary responsible, or we can see the who is the primary ground level worker for implementing the ICDS program at the village level? What is ICDS? ICDS is the Integrated Child Development Services. Okay, so the most important thing all you people have to understand regarding the ICDS is to main focus on the child development here. Okay, so we will integrate this one with the another health program and to implement this perfectly to maintain the child health. So that is the ICDS here. Okay, so who is the ground level worker who will work under the ICDS program? Bacho, ASHA worker will not work under the ICDS. She is work under the National Rural Health Mission. Okay, so and this USHA worker, she will works under the National Urban Health Mission. Okay, ANM also mostly works under the National Rural Health Mission, and Anganwadi worker and Anganwadi helpers, these are works under the ICDS. Okay, so at the village level, at the ground level, so she is the main very important key part of the ICDS program, that is the Anganwadi workers. Okay, the most important question, the correct answer for this one is the Anganwadi worker will goes to the correct answer, right? So this is the very basic question that may strikes in the exam, but there is some important questions on the ICDS program. Quickly we will revise all the golden points on the ICDS programs. Okay, so ICDS is the full form itself, it may comes in the exam. What is the full form of the ICDS? That is the integrated, means we are integrating, means we are adding the all the beneficials programs along with this one to improve the child health here. Okay, so integrated child development services is the full form of the our ICDS. It is the most important. So integrated child development services launched in the year of the 1975. Okay, so here it is in launched under the Ministry of the Women and Child Development by the Government of India. The target groups are the children's of the 0 to 6 year, it including the both boys and girls, and pregnant women, lactating women, adults and girls. Okay, so these same benefits they are getting under the Sublime Portion 2.0 also, but there is one program called as the Mission 2.0. So I will Mission Portion 2.0, which integrating the all ICDS and Portion Abhiyan too. Okay, so Portion Abhiyan and ICDS both are integrately doing so under the Mission Portion 2.0 program. Okay, so this was the new thing. I will teach you people in the next second part about the Mission Portion 2.0. Okay, so just now remember ICDS is integrated with the Portion Abhiyan in which program? So that is under the Mission Portion 2.0. Okay, so this is the a very important, a very basic about the ICDS. Okay, what is the primary purpose of the ICDS? Means to improve the nutritional health status, means so here we will give a free food. Okay, free valid nutrition to the a child below the age of the 6 year. The most important question, that is which age group children are included under the ICDS program? The child below the 6 year of the age groups, or we can say the 0 to 6 year is a child who all are included under the very important ICDS program. Okay, so this ICDS program which creates the base or the foundation for the proper physical growth, physiological growth, and psychological and social development. Okay, physical and social development. So it creates the foundation for the proper psychological, physical, and social development. Okay, so then it reduces the incidence of the mortality, morbidity, and malnutrition. How means we are giving a good nutrition, means there is no malnutrition. Okay, so the good nutrition means child will be healthy, so there is no disease. Okay, so there is no disease means there is no death. Okay, so this is the main concept of the ICDS, where we are giving a good quality nutrition which preventing the malnutrition, morbidity, mortality under children's, plus it will prevent the school dropout also. Okay, so the main reason of this childs to skip the school is that is the disease conditions. Okay, where we are giving the good nutrition which preventing the disease condition. Okay, there is no disease condition means there is no school dropout. Okay, the most important thing to reduce the incidence of the mortality, morbidity, malnutrition, and the school dropout. Okay, then comes to the promote effective coordination of the policy and implementation among the departments is the most important. Okay, and enhance the capability of the mother to take care of their own health and nutrition. This is the another objective. The most important objective you people have to know about here is the this nutrition to the below 6 year children's, and reduces the incidence of the mortality, morbidity, and malnutrition in the and school dropout also. Okay, so then proper coordination, policy, and implementation among the departments. So that is also mostly promoted by the ISDS programs. Okay, so this is the golden points. Just you have to remember about this one. And the benefits or services which are provided under the ISDS is the supplementary nutrition we will give. To whom all we will give? We will give this one children less than 6 years, pregnant woman, lactating woman. Okay, so supplementary nutrition will be given to the pregnant woman, lactating woman, and children less than 6 years. Okay, in your villages, I think you people have seen some pregnant women are going to the Anganwadi. Okay, in the Anganwadi, they are giving the what we can say the groundnuts and the jaggery. Okay, so everything they are giving as a nutritive pack to the pregnant woman. So that is under the ICDS program. Here they are giving a supplementary nutrition to improve the hemoglobin level of the pregnant woman and to prevent the anemia. Okay, so here the jaggery and the groundnuts will prevent the anemia by improving the hemoglobin level, because the both are rich in the iron. Okay, so that is the supplementary nutrition we are giving there. Okay, so along with that, the most important is the immunization. It will make sure about the pregnant mother immunization. Okay, and the children immunization of the 0 to 6 year. Okay, for the children of the 0 to 6 year, it will make a checks the status of the immunization. And in the pregnant woman, that is the TD1 TD2. Okay, so both it will make ensures the both pregnant woman and child taken the vaccine. Okay, so then health checkup for the children, pregnant woman, lactating woman, and referral services will be there for all beneficiaries. For children's also, okay, for the pregnant also, lactating ones also, and woman with the reproductive age also here. So there are referral services will be there. Then non-formal preschool education for the children of the 3 to 6 years age group, and the nutritional health education for the woman of the reproductive age, that is from the 15 to 45 year. Okay, so the most important here, the health education including the personal hygiene, okay, genital hygiene, sex education, everything will be included in this one. Okay, the most important services and their target age group children's. So these are the very important point, and people have to understand the hierarchy of the ICDS, because many times they have asked the question who will work at the block level. Okay, so that is the child development project officer is the person who will work at the taluka, or we can say at the block level. Okay, so mukhya sevika will be under the taluka level. Okay, and anganwadi worker will be under the mukhya sevika. Okay, the most important at the state level. Okay, at the central level there is the ministry called as the Ministry of the Women and Child Development. Under this ministry there is a director. He is the IAS officer. Okay, so here he will administrate this ICDS program. Okay, at the state level. Then at the district level there is a DPO, is the district program officer. So under this DPO there is the CDPO, is that means child development project officer will be there at the taluka level. Okay, so then supervisor and mukhya sevika will be there at the below the, or we can say the under the CDPO. Okay, so then Anganwadi worker will be there at the ground level. Okay, and along with Anganwadi worker, Anganwadi helper will be there at the ground level. Okay, so these question at the ground level or at the village level, who will work? That is the Anganwadi worker and Anganwadi helper. Okay, so then the supervisor will be there, and there are one supervisor for the 20 to 25 Anganwadi centers, and Anganwadi worker is the key person who work at the village level. These are the important golden points you have to understand and remember, and to give the best shot in the exam, right? So hope ICDS is clear. And the next very important question you people have to understand related to some very important website portals or the apps under the community health nursing now, which are in the trend. Okay, so that one we will study here about the Nikshay portal and about the Anmol. Okay, so we will study in detail about the all the online portals which are most important, right? So just read the question, read the option. Let me drink a water for a 5 seconds. Don't sleep, bacho. This is the matter of the, yes, this is the matter of the 1 lakh rupees salaries per month, right? So sleeping in the class is strictly prohibited. If you are sleeping in the class now, means you will be out of the selection list. Yes, just open your eyes and listen carefully what I am explaining. Make a notes of this one. The best method of studies is by making the notes. Okay, you are just listening to the community class means you will definitely sleep. While whatever the golden points I am explaining, if you are making a note of that one while explanation means that is most important to you. That is what I have added some images in the explanation. Okay, so I made it somewhat creative to impress you. But if you people are sleeping means that is very dangerous sign of to be out of selection list. If you want to be a topper means just pop up yourself. Okay, drink water, open your eyes, then close your eyes, and again open your eyes and start again, right? So we'll start now. Okay, so the very, very important and very basic thing all you people have to understand about the primary purpose of the Nikshay portal. What is the Nikshay portal? What is the meaning of the Nikshay? There is one more term called as Nischay. That is another thing. I will explain with images in the next slide. Okay, so this is a Nikshay. What is the Kshay here? Kshay means it is a word in Hindi. Kshay means as a TB. Okay, tuberculosis. In Hindi we call it the Kshay Rog. Okay, so here is to destroy the TB. We have one portal, okay, which monitors the all real time treatment, which monitors the all the data of the TB patients in the online portal. Okay, so which was launched by the government of India. The portal name or the app name what we call as in the Nikshay app for the Kshay Rog or for the TB monitoring. Okay, so the most important, what is the primary purpose of the Nikshay? Kshay means the portal launched by the government of India. This one. Okay, so here the answer goes to the option A, to track the child immunization status nationwide. Nationwide, no, it is not correct answer. Then to provide the digital identity to the rural households, not correct answer. And option C, to monitor and manage the tuberculosis cases in the real time. Okay, so this is the correct answer, to monitor and manage the tuberculosis cases in the real time. So this is the correct answer. So we want to monitor the TB cases in real time by using the Kshay, that is the Nikshay portal, okay, for the TB. The most important clue I have given. So let me see some important point related to Nikshay. So this is the mobile here, and which is having the app called as the Nikshay app, okay, which was launched by the Central TB Division by the Ministry of Health and Family Welfare. Then it will be supports to, previously it was supporting was the RNTCP program, that is the National Revised Tuberculosis Program Control Program. So now it is supporting the NTEP, that is the National Tuberculosis Elimination Program, because we are at the level of the elimination of the TB. So still not eliminated, we are trying. Okay, so by the program called as the NTEP, that is the National Tuberculosis Elimination Program. Okay, so then the primary purpose is to real-time tracking the TB patient, monitoring the TB adherence. Okay, so treatment adherence. But so it was very, very important. Consider why we will primarily focus on the treatment adherence here means why we have brought the dots therapy here means the most importantly to prevent the drug resistance TB. Sir, how monitoring the treatment adherence prevents the drug resistance TB? Let me explain you the thing. Consider he is the Mangappa. Okay, he is a Mangappa who is suffering from the tuberculosis. Okay, now he came to the hospital. We have sent his sputum smear for the acid phosphobasically gram staining. Okay, so after Jhadan staining, he got a TB positive. Okay, he got the TB positive, and in X-ray also there are sign of the tuberculosis. Okay, so now we have started the treatment for him. Okay, now we have started the treatment for him. So now he is on the anti-tubercular therapy. Okay, so actually he is first time when he diagnosed, he may diagnosed with the drug sensitive TB. Okay, drug sensitive TB, right? So now we are having a 6-month plan for him. Okay, bacho, if you are getting the fever, how many days you will take a paracetamol? 1 day, 2 day, or maximum third day you will take a paracetamol. Okay, so if you are getting some minor infections, how many days you will take a antibiotic? You will take for the prescribed days maximum 3 days, or we can say some in some very severe infections 7 days. Okay, but here for the TB treatment we have to give for the duration of the 6 months for the a drug sensitive TB. Okay, so here the patient may takes the anti-tubercular drug for a first 5 days, 6 days, 7 days, then he will start to ignore the medications because of its side effect or some other reason. Okay, so now he took some medication, means incomplete treatment he took. Okay, so what all are the tablets he took? Those tablets started to destroy the TB bacteria, but he suddenly stopped the tablet, means these bacteria which are there inside of the body of the patient will get resistance to this tablet. Okay, so that time it will makes a TB to drug resistance TB. This is the very dangerous TB, more dangerous TB. If this TB started spreading in the community, means the entire community will destroy. Okay, so that is the reason we don't want the patient to skip the medication. So the main purpose of this all online monitoring portal is to monitor the treatment adherence. Okay, if the patient is maintaining proper treatment adherence, means we can prevent the drug resistance TB, and most importantly we can protect our community. Okay, so the most importantly I am explaining the actual concept behind this one. So this is the reason where we have brought the dots therapy as a word. Okay, that is the dots 99, you can say. I will explain about dot 99 also. It's a directly observed treatment short course. Okay, so yes, what is the dot 99 also will explain, don't worry. Okay, so here the Nikshay portal is for the monitoring the treatment adherence, and we are sending some money to the patient by the DBT. What is the DBT? Here the DBT stands as the a direct benefit transfer to the TB patients. Who all are the TB patients who registered under the Nikshay portal? Okay, who all are the TB patients who are registered under the Nikshay portal? For those patients, we will give a monthly 500 rupees. Okay, monthly 500 rupees directly through the app, through the patient bank account. Okay, so why we are giving the 500 rupees, sir? Here, because a TB patient should and must take the high protein diet. Okay, but TB mainly affects to the people who are living in the crowded area and people of the uh, below the average level of the economic status. So we are asking the patient to have the daily 2 eggs. 3 egg means it costs about the 15 to 20 rupees per day, but the patient who are living in the very crowded area and the below the poverty line patients, so we are asking him to invest the daily 15-20 rupees, means he will not invest on the food. Okay, again there is the TB may get worsen in that those conditions. Okay, so in order to prevent that one, we must and we should give the high protein diet to the TB patient. Okay, in order to enhance the okay, so high protein diet availability to the TB patient, we will ask him to take a daily protein diet. We will give the amount for that one. There is the a monthly, so not daily. It is a monthly 500 rupees. We will give to the TB patient for his uh, good high rich protein diet. Okay, the most importantly how the money will go to the patient by the direct benefit transfer from the app, Nikshay portal app, to the patient bank account directly. Okay, so it will ensure the accountability among the public health and private health sectors. Okay, so who are to take care of the TB patients here. Okay, so the most important about the Nikshay portal and the yes the direct benefit transfer, the many time asked questions. Okay, so in the state government exams. Okay, so it is most important. Then while are preparing for the state government exams, it is important them to know about the direct benefit transfer for the TB patients. Okay, there is the DBT for the TB patients. Okay, here through the name we are giving, here is the Nikshay Poshan Yojana. Okay, under this Nikshay Poshan Yojana, the Nikshay means to treat a TB. Okay, Poshan means a food here. Okay, so to give the high quality and high rich, protein rich food, so there is a Yojana under the Nikshay. Okay, so under the National Tuberculosis Elimination Program, which was launched in the 2018 here. Nikshay Poshan Yojana was launched in the 2018 here. So here under the NTEP program, our main objectives of this one is to nutritional support. Here means the high protein diet for the TB patient without investing money from his pocket. Okay, so here we are giving the amount of the 500 rupees per month, okay, for the duration of the entire TB treatment. Okay, monthly we are giving, okay, per month, right? So then mode of the payment is the direct benefit transfer. Here the DBT stands here is the just it's a mode of the payment where we are giving to the patient from the Nikshay portal directly to the patient's bank account. Okay, so via Nikshay portal, this is the most important one time asked question and the initiative, and make sure that which diet we will prefer for the TB patient. We will prefer for the high protein diet. Okay, the most important thing all people have to know about this one. Okay, the Nikshay portal and related to the DBT and the high protein diet in the TB patient, most important. Okay, so again, purpose is to improve the treatment adherence. Okay, so then to reduce the out of pocket expenditure means from the investment from the patient we are reducing here to ensure the better nutrition and recovery of the TB patient during the treatment period. Okay, so that was the most important thing all people have to know. So just we have previous slides we have studied about the Nikshay. Okay, now we will study about the Nischay. Okay, what is the Nischay? Nischay is the just it is a kit. Okay, so Nischay is a kit like this which will be given by the ASHA workers, or we can say the ANM workers who are working at the periphery to a eligible couples who all are missed their period. Okay, means last 1 to 2 months there are absent of the menstrual cycle are there. So now the woman, she is living in the rural area, she is suspecting she is pregnant, so she will approach to ANM workers who all are working in the village level, or the ASHA worker who all are working at the village level. She will communicate with them, so they are having this Nischay kit with them, so they will give this Nischay kit for the rupees of the 1 rupees. Okay, for the 1 rupees they will give one Nischay kit to that woman where she is having the absent of the menstrual cycle, so she will check the uh, pregnancy positive or not by using by adding her urine into this pregnancy kit. Okay, so means the Nischay here is the just a urine pregnancy kit where we will check whether the woman is pregnant or not. Okay, so I will explain what to see in the pregnancy kit. Okay, before that one, let us see a golden point over the Nischay. Okay, Nischay is a rapid urine pregnancy test. Okay, so then it is used by the ASHA worker and ANM worker and other frontline workers also, help in the early detection of the pregnancy. If the pregnant woman she is early diagnosed or detected means, so she will register early to, okay, so she will register early to the healthcare facility. So early registration of the antenatal care also will be there. Okay, then results are typically available within the 5 minutes. Okay, so when pregnant when the woman she will add the urine to this particular kit. So okay, so then two lines are coming means one line is for the kit is valid or not. Okay, another line is she is pregnant or not. Okay, so both are coming means kit is valid and pregnant is present means she is pregnant now. Okay, so then another very important line. Okay, only one is line is coming means the kit is normal and functioning good. Okay, only one line is there, another line is there, not there, so is not, she is not pregnant. Okay, and another here is the kit. Okay, so in the kit there is no line. Okay, so there is no lines inside. Okay, means the kit is not functioning properly. Okay, so it's a meaning like that. Hope it is clear to you people, right? One line is there, kit functioning. Two line are there, line are there, kit is functioning and she is pregnant, and no line, so not kit is not properly functioning. Okay, hope it is clear to you people. It was a very basic thing all you people have to understand. Okay, to implement in the clinical settings also. Okay, so then comes to the Anmol. What is Anmol? What is Anmol? Here, the word itself telling ANM means auxiliary nurse midwife. She's online. Okay, so what it means here, whatever the data the ANM is collecting at the village level, that may be about the number of the pregnancy, that may be about the number of the newborn care she have given by the home based neonatal care. Okay, home based young care. Okay, so then the immunization status, then the VHND program she is conducting at the Anganwadi level and at the sub-center level. So everything details she need to add in this Anmol. Okay, so where we will assess the effectiveness of the our national health programs. Bacho, most importantly, whoever it may be, who is planning for the national health programs, he will plan. After that, the funding will be there for that one. Okay, after that, it will comes to the implementation level at the work. Okay, at the village level. Okay, so here maybe a PM, CM, whoever it may be, started the program, and funding also done by the uh, economic minister. Okay, but here the ANM, CHOs, and our what we can say ASHA workers and PHC doctors, if they are not working properly, means this entire national health mission is going to be a waste, and this all fund is going to be a waste. Okay, so in order to monitor this one perfectly on the online, the government initiated this Anmol program. Okay, to assess the effectiveness and to collect the real time data from the ANM candidates, okay, who are working at the village level. Okay, so the most importantly, now the India is the best health monitoring system, means our all ANM, CHOs, PHC doctors, everyone is working perfectly at their perfect position. Okay, so this was the current data what it says. Okay, so the most importantly, the ANM Anmol, here the meaning is the ANM online. Okay, so this is the app here. ANM should and must enter the all RCH registration should be done, means the first antenatal visit should be registered here. Then VHND, that is the Village Health Nutrition Day. Okay, so this Village Health and Nutrition Day will be celebrated every monthly. Okay, every monthly, once every monthly at the village level. Okay, it may be in the Anganwadi center, it may be in the sub center, it may be in the school, where we will educate the different community peoples regarding the importance of the nutrition, importance of the protein rich diet, importance of the immunity and nutrition. Everything we will explain in the Village Health and Nutrition Day. The full form may comes in your exam. What is the full form of the VHND? Okay, so the VHND is the Village Health and Nutrition Day. So we will celebrate every monthly at the PHC level, sub-center level, and Anganwadi level, and in the schools. Okay, the primary schools also we will recommend. Okay, so then the eligible couple list should be available with the ANM. Okay, then the pregnant woman list, then the child care list, then counseling and work plan, and whatever the updates are there in the national health mission, everything will be we are getting from the Anmol app. Okay, that is the most important thing. So that is related to the Anmol app. Okay, so yes, who is having the experience of the peripheral work, so they should know about this one very easy. Okay, so because they will do this one on the daily basis, HMIS, okay, Anmol, then this Nischay kit, this is a matter of the single minute work for the CHOs, ANMs, and ASHA. Okay, so students who are freshly preparing for the exams, so it's somewhat difficult for them, but I have made it very clear. Okay, what is Anmol actually, how it practically works, I am explained. Nischay, what is it is, how actually practically it works, I explained. What is Nikshay, how it actually practically works, I explained in detail. Okay, so this basic idea and the golden point on the particular program is most important in the community. Okay, so then comes to the justice. Anmol is a digital tool developed by the Ministry of Health and Family Welfare to enhance the maternal and child healthcare services in the India by knowing the eligible couples, VHND program implementation, RCS, that is the reproductive and child health implementation, and the pregnant woman, child care and counseling, everything. So means the primarily targeted to improve the mother and child health. Okay, by the this Anmol app. Okay, so it is primarily handled by the ANMs. Okay, that's the auxiliary nurse, midwives to track and manage the health status of the pregnant woman, children, and eligible couples. Okay, so I have explained that one in detail in easy. Okay, so then comes to the 99 dots. What it is actually? It is on the very low cost web based